Hi, Jade here with Essential Ways. I am going to do a fun little Q&A with Dr. Steve. He is part of Advocare Clinic here, and they do CBD and cannabis and a lot of medical marijuana and different things.
Correct.
And we're going to talk today about how to boost your immune system in today's current times of what we're dealing with. And I just wanted to do a few things and talk about a few different products, mainly CBD, which is really awesome. If you haven't tried it, please stop in to Advocare, stop into our shop and try it. It's really awesome. So I want to talk a little bit with Dr. Steve here. Tell me a little bit about yourself before we get started.
Well, I have a 20-year background in emergency medicine and have moved into the medicinal cannabis arena to help folks that had kind of reached the end of their rope for other options for things like pain, cancer, MS. They had been faithful to the traditional methods of caring, and it just, medicine, and it just didn't help. I still practice emergency medicine, but I do this as well. We've found that we've been able to help a lot of folks get away from opiates, which has been a blessing.
Now, how long has Advocare been available?
So we've been around since March 1st of 2019. So
you
this
guys
is
are
our
selling it
annual.
here.
As far as CBD, you can't sell any cannabis here as far as anything higher than 0.3% THC.
But Advocare is celebrating a year?
Yeah, we're selling our 1
Yay,
year. It's awesome. Yeah,
Yay.
we're really happy about
anniversary.
that. We've been blessed to be able to do this and to grow and serve our patients, and we just really enjoy doing that.
That's great.
Our focus is really on education when we bring patients in and helping them to build a program that has a high likelihood of success for them. As you can imagine, you get a 70 or 80-year-old patient in that's never been involved with cannabis, and they're scared. They don't want to smoke. So you have to be very creative on how you use the dispensary menus to help them to find some methods that will help them from the delivery side as well as the pharmacokinetics of what they're taking and what they're taking it for.
And traditionally, we're taught in today's day and age that cannabis is bad, but technically cannabis is an amazing plant-based medicine that can help our endocannabinoids, our cannabinoid system. I mean, our whole, I'm sure you can talk about all that different immune response that CBD can invoke in our healing and helping us get over what we're dealing with. There's lots of things to talk about.
That's exactly right. So the interesting thing to realize is that all of us from eons ago have what's called an endocannabinoid system. It's within our bodies, and it's really our system of wellness, balance, and repair. That's why it's there. That's how it works in its natural state, and with a little help from the outside from what we call phytocannabinoids, because they're not from inside the body but actually from a plant. The cannabinoids that we make in our bodies are called endocannabinoids because they're made inside our bodies and they work within that system normally. But that system is made for wellness, balance, and repair, and actually since we're talking a little bit about our immune systems today, the thing to know is that the CB2 receptors, which are one of the receptor types in our body that the endocannabinoid system uses, are tied to our spleen and all of our immune cells, our white blood cells.
Now the spleen, I've learned from researching and looking into different things, is where our immune actually is created. Is that correct?
A good part of it. There's multiple different lymphoid tissues or immune tissues throughout our bodies. Your tonsils are an example of that. When you get a sore throat and you get swollen glands, those are also lymph tissue. The immune system is heavily dependent upon the spleen. It manufactures a lot of the antibodies, but the whole system is controlled by in part, I should say, by the endocannabinoid system. And a robust immune system in these times is absolutely something that we're looking for.
Very much. And a lot of people, like right now, are looking to different products, not just pharmaceutical type based products, because let's face it, antibiotics are not antiviral. Is that
correct?
So
correct. And that's
a virus running around and doing different things. We need things that are going to be on a more
holistic would be a good word.
Plant-based, antiviral.
Immune boosting would be another word. Those would be very good words to use. And basically, when you talk about that, you got to talk about different facets of how do you keep your immune system in tip-top shape.
Yes.
So one of the things that you want to do is get plenty of rest.
Perfect.
Get some exercise. Now, I know we're social distancing as you and I are keeping that
trying
distance.
to keep that distance.
You know, hand washing is paramount to preventing spread, wiping down surfaces and all that stuff.
So
But as far as our
hand
bodies
washing,
themselves,
because a lot of people are like, should be washing their hands, but I mean, a typical hand washing regimen should be any kind of soap, or should we be doing
soap and water?
Just soap and water.
A
So
good
it doesn't
20 to
make
30 minute good scrub.
30 seconds.
Yeah, the most important thing is some soap and water and wash
So do we
those
need to
hands.
get antibacterial soap, or will any
Well,
soap
obviously
do?
that would be helpful.
Okay.
Yeah, an antibacterial soap would be preferred.
Okay.
But really just making sure that you spend enough time at the sink washing your hands. Most people do a quick towel off and they're out. Yeah, I'm out of the contest.
Right. But you want to stay in it as long as possible.
You want to do at least 20 seconds.
Sing a
and
couple
probably 30
songs.
would be best, and just a good wash and rinse and use a clean towel. And
common sense, right?
Common
but a lot of
sense stuff.
people at this time get scared, the fear takes over. We're trying to keep that fear a little bit on the bottom side too.
Right, because fear in and of itself can be toxic, right?
It can create an undesirable immune response, is what I'm learning.
Well, if you're not sleeping because you're fearful, your
Right.
immune response is going to suffer.
Right.
So sleep is restorative, making sure you're getting enough sleep, getting some exercise, making sure that you're using the right foods in your body. Food is medicine, as you well know, and,
Yes.
and I would defer to you on some of the things that you're doing, which are amazing.
Yeah.
The high antioxidant.
Yeah, I make this elderberry elixir, which has amazing immune boosting response. Plant-based materials, elderberries, ginger, cinnamon, cloves, which we're finding out cloves are one of the highest antioxidant products out there, plants out there. Allspice, star anise, they have wonderful benefits to them at an antiviral, antibacterial, anti-germ. I mean, it helps to get rid of all of these different things that we come into contact, and helps to boost our immune system and give us that nice, robust protection that we all look for.
A lot of people refer to those types of foods as superfoods.
Superfoods, yes.
Yeah, because of their antioxidant.
Yeah, and CBD is another superfood.
I would say it has
have-
definitely some benefits in that it works with our immune systems to boost those.
Yeah.
And I think there's definitely benefit there. And it also helps with inflammation, and it helps with anxiety.
Which a lot of people have right now.
Yes,
with what's going
exactly.
on.
So if you don't qualify to be in the registry and are able to use some THC with CBD, which is really gives you that entourage effect to calm anxiety and stressful situations if you have another qualifying condition, because anxiety by itself is not. CBD is a very nice substitute for a lot of folks, and we have plenty of patients that do well with just
And they can just come in
CBD
here,
regimens.
right, and pick it up?
Yes, they can
Or do
come